Good afternoon, everyone. Premier Ford's press conference is just wrapping up. They're on the last question. I'll give it another minute or so here. Thank you for joining us again today. There's a few things that I'm going to discuss, and then I'll open it up for questions again. We'll follow the same format where we have in the past. If you could just raise your virtual hand for me when we come to the questions part of it. A number of things have gone on over the last 24 hours. I'm going to start with the economic pressures. One of the things that we're seeing in Ontario right now is that obviously there are a lot of job losses. There are a lot of companies that have had to shut down for a period of time because of what's gone on with COVID-19. Locally in Peterborough, for the month of March, there are 2,300 positions that people lost their jobs on. Now, that was basically just half of the month. Those numbers, I think we're going to see them increase in April as well. We've gone from a unemployment of about 5.5% to about 7.5% in the course of a month across all of Canada. So those are significant losses of jobs. We need to be prepared for that as we move out of this COVID-19 crisis, or when we move out of this COVID-19 crisis. And Ontario has decided that we're going to form a committee on economic recovery. There's a website for it, ontario.ca/emergency assistance. This committee is going to be formed with a number of MPPs. There'll be some people from business, from the industries as well. And we'll be looking at ways that we can kickstart Ontario's economy again once the COVID-19 crisis is over. And I can't emphasize that enough. It's not that we're doing something to start the economy today. We're looking at the planning that we need to do so that when the COVID-19 crisis is over, that we can get Ontario's economy moving quickly again. In terms of testing, Premier Ford announced yesterday that we will be doing more testing for COVID-19. We now have a capacity of about 13,000 tests per day. The time it takes to get the test back have improved significantly from when this crisis first started, and our capacity to do testing has increased significantly. Last night, new guidelines were sent out to all of the public health units in Ontario, giving direction on how we're going to be moving forward with the testing so that we can increase the number of people who are being tested for COVID-19, get the results back quickly, and make sure that we don't have people who are asymptomatic as carriers of the disease going out and passing the disease on to someone else. We're going to be prioritizing at the very beginning our frontline healthcare workers. We want to make sure that everybody at hospitals, at long-term care facilities, paramedics, and so on get tested as part of that first priority group. These are the people who are interacting most with others, and we want to make sure that everybody that is coming in contact with someone from a healthcare perspective has been tested. It will take us a few days to get through all of that, but as I said Some new guidelines have been sent out to all of the public health units as of last night, and direction on when they should and how they should be proceeding with testing as we move forward. A lot of organizations, a lot of groups, businesses in Ontario have stepped forward and made donations of PPE, and we can't thank people enough for that. Later today, we'll be releasing a portal where any organization or group that has a sizable donation to make, if they're not 100% sure where they should make it, we're going to ask them to go to this portal to register that donation. One of the challenges that we're now facing is that there are some unscrupulous people and unscrupulous companies who are selling PPE products and misrepresenting what they actually are. We saw this recently in the GTA area, 65,000 masks that were labeled as N95. When they were tested, they were not N95 masks. We need to make sure that all of these products, when they're being donated, when they're being purchased, they are what everyone believes they are, so that we're protecting our frontline healthcare workers. Later today, that portal will be released, and we'll be happy to share that information with everyone when it happens. It'll allow us then to centralize that. We'll have a central framework for where that PPE will be, and it can be disseminated where it is most needed. It's not to stop someone from donating product directly to one of the organizations, but this is just a way for us then to have the product come into a central place, get the testing done on it to make sure that it is what it says it is, and then disseminate it to where it is needed the most. In terms of what's happened at PRHC, I know that there's going to be some concerns about that. I have the utmost faith in staff at PRHC, and I believe that they will be following all of the appropriate steps as we move forward to make sure that nobody is put at risk. If we look at the cases themselves, people who tested positive had always been taking precautions to make sure that they weren't going to be spreading any of the disease. And at the moment, there is no evidence of transfer from them to anyone else. With the protocol changes and the increased testing capacity, we're going to see staff at PRHC all tested to make sure that everybody who is coming into the hospital is going to be as safe as possible. All of the staff at PRHC are as safe as possible. We really want to make sure that this virus does not spread. And the last thing I'd like to mention is we're going into a long weekend. We'll have 4 days, 2 of them, the weather forecast looks like it's going to be nice. We have made tremendous gains in getting ahead of this disease over the last 2 weeks. We're seeing the results of the physical distancing. The testing now, it's about 24 to 48 hours when we get the results back. So all of the results that we're seeing from this point forward are people who would have gone through the 2-week intubation period already, or incubation period already. So these are very accurate numbers. And we're seeing this week that we're not having the exponential growth. The social distancing that people are doing is working. And we need to make sure that this weekend, we still observe that. We need to make sure that this weekend, people have the opportunity to enjoy the 4 days off, but they don't forget what they have been doing that has made a positive effect in slowing down the spread of this disease. We don't want to be in a position 2 weeks from now where there's a spike in positive tests again because people went out on Friday or Saturday in the nice weather and they forgot about physical distancing. I'll open it up for questions now. If anyone has a question, please raise your hand for me. Mr. Barker, go ahead, please.
Yeah, so my question is, so Beavermead Park is unlikely to open this summer for paid campers. Now, Mayor Therian was saying that because of that, she can't house homeless people in that park. Now, my question is, would the province bend its rule and then allow a seasonal campground to open for conversion into a homeless camp?
Mayor Tyrion can always reach out to my office to see what we can do to work with her to make sure that anyone who is housing insecure has a proper place to live. We've already worked with the city on what their contingency plan is right now. I was involved with the city when we were doing the search for other facilities rather than using Brock Mission, where we needed to have more room for that physical isolation. They have not approached me yet about whether or not they could use Burnham Park as another facility for someone who is housing insecure. Right now, I know that they have a contingency plan in place using the Sport and Wellness Center, and they have other facilities that they have set aside or they have earmarked as potential overflow locations. But again, no one from the city has approached me about the possibility of using Beaver Mead for it. And I'm not sure that that social services wants to use Beaver Mead at this point. Having people stay in tents creates other challenges. I would ask that anyone who's in the position where they are housing secure, that they work with social services and have social services help them find a placement at one of the shelters.
Thank you.
Any follow-up questions? Mr. Barker, before you
Yes.
follow-ups?
Well, it's not really, but it was more, last year they were offered, like the homeless were offered RVs from a dealer in Norwood. Would that change how the distancing in your eyes with regards to having Beaver Mead Park used as a homeless camp?
There's a number of different things that go into the thought process when they come up with how they're going to house those who are housing insecure. RVs are a potential solution. I'm not going to suggest that they're not. They create other challenges, though. And when we're talking about the COVID-19 virus and how it spreads, now we're into a challenge of how do you maintain an environment for someone who is housing insecure so that they're not put at an additional risk because of sharing spaces, because of cross-contamination when they're touching something. You have to make sure that you're looking at how do you disinfect in the right way. I'm not an expert in disinfecting. I'm not a medical expert, so I can't offer you opinion on whether or not having an RV is going to be safer than having someone stay in one of the shelters. What I think needs to happen is that broader discussion needs to be done, and how do we make sure that we're doing things to provide the safest possible environment for these people. We can have as many different ideas as we want. Some of them are very, very good ideas at a first blush glance, but then you have to drill down into what would actually be the effect. Does it actually create a situation where someone is more at risk? Does it create other challenges that may create other risks for those people? And all of those get brought into the decision when the decision is made.
Okay. Thank you.
Thank you. Any other questions? Warden Jones, I'm sorry, I should have asked you first if you had any comments that you would like to make before I opened it up for questions.
No, thank you for having me again. Peterborough County is still working very hard to abide by the rules and keep our staff safe, obviously. Certainly the battle we're still having is trying to get the word across to our seasonal residents to, double think before they come up here. The rules are quite simple. Please just stay at home. It's not about us not respecting them or respecting their right to come to their cottage. It's about saving people's lives. And we just want to remind everyone again to please stay home and let's get through this. And then we can welcome you with open arms and everybody can maybe get back to normal. So that's about it. Our county staff are doing just a super job of keeping things going down the road, and our staff have been great, and our paramedics, we really do salute them for the hard work they're doing on the front lines. So everything is well, and I sure wish everyone a very happy Easter weekend.
Thank you very much for that. If there are no other questions, then we'll wrap things up. Thank you very much again. Please enjoy this Easter long weekend. Please also recognize the social distancing that we need to maintain to continue the good work that we're doing so far in reducing the number of infections that we're seeing in Ontario. Everyone have a great weekend, and God bless all of you. Thank you.